Hi, and welcome back. My name is Benjamin Stewart. I'm the Senior Academic Advisor for Nursing, Allied Health, and STEM here at Kingsborough Community College. In the last video that I made, we talked about the preclinical phase of the nursing program, and today I just wanted to continue on and talk about the clinical phase of the nursing program. So if you remember, just a quick recap, we had talked about all the different requirements and classes that you would most likely have taken before you entered what's called the clinical phase. Most of those classes can be taken during the preclinical phase. The only classes that cannot be taken during the preclinical phase are the actual clinical nursing courses. That's nursing 17 through nursing 24. And I'm going to explain how we break those down into semesters here at Kingsborough. So after you've heard back from the nursing program, passed the TEAS exam, taken all your prerequisite classes, and have been sent information on the orientation, you begin to register and take your clinical nursing courses. This program, once entered, is broken down into 4 semesters, which is effectively is 2 years, which is why we still call it a 2-year degree. So if we move down the page, past this, we'll move on to the area known as the clinical component area. So in the first semester, as you can see, there's 4 classes. However, most likely you have already taken these 2 courses before entering the program, which is perfectly fine. If you've done so, in fact, if you notice, and mostly all of these, actually all of these semesters, there are classes that are attached to these semesters, which you may have already completed before you've gotten to those semesters. That is perfectly fine. This is actually a good thing and actually can help you along the path of transitioning from your AAS degree to your BSN degree. Because if those classes are not occupying those areas, you can actually take courses that you may need at the bachelor's level, so that when you transfer over, you would have a little bit of a step up from what you would normally have to take when you go into those programs. But let's go back to this first semester here. Assuming that you've taken these 2 classes, which is Anatomy Physiology 2 and Human Growth and Development Psychology 32, the first 2 nursing classes you're going to end up taking is Nursing 17 and Nursing 18. Nursing 17 is Calculations for Medication Administration, and Nursing 18 is Fundamentals of Nursing. So these are your building block courses or your foundation courses for the clinical program, and this does come with a clinical affiliation. What a clinical affiliation is these are different sites around the city that we can send students to in order to gain real-world applicable experiences based on the information that they learn in the classes, such as Nursing 17 and 18. So what you learn in these classes, you'll go out to a site and you'll be expected to observe and possibly perform in a certain capacity, not where you actually perform on a patient, but in simulations where you perform the same duties in order to get skills which you'll use in your real career field. Once you complete those 2 classes, you'll move on to your second semester, where you'll have Bio 51, which is Microbiology of Health and Disease, and Nursing 21, Nursing the Ill Adult 1. Now, this course you may also have completed, or you may want to take this in between the semester, the first and second semester, during what we call the module, the 6-week module. The reason I say this is because this is a pretty heavy class, and this is a pretty heavy class. Most students want to focus their time on this class and energy on this class as well as this class. So what they'll do is they'll put that in between the semesters so that they can still have the component which will allow them to register for this course, meaning that this is a pre/co-requisite. You could take it together, but you probably don't want to. And then you would pass this class and move on to this course. If you don't decide to do that, it is pretty difficult to find a schedule that will accommodate the nursing class here and its site component or its clinical component, especially if this schedule conflicts with you going to the clinical phase. And the nursing department does try to do a very good job of placing students in clinicals that don't affect their academic schedule. However, it's not always possible. So this is why I would recommend taking this in between the semesters. At any rate, you'll pass this class, you'll move forward to this course. After passing this course, you would go on to your third semester, which most likely you would have this course completed again. And then you would also have your Nursing 20, which is nursing the emotionally ill, Nursing 22, which is nursing the ill adult 2. So a continuation of the ill adult 1. Again, both of these have clinical affiliations, so you will be expected to go to sites to have hands-on, real-world applicable training. And then you would move on to your fourth semester, having Sociology 31, which most likely you've already completed again, and the last 3 nursing courses: the Family-Centered Maternity Nursing, Nursing of Children, and Issues in Nursing. So this would be your last semester here. All these have affiliations as well, as you know, and these also prepare you to take your nursing license exam. So completing all of these courses and having 66 credits at the very least for the degree. You have to have 66 credits for the degree, and if you transfer it in, 30 of those credits must be taken here at Kingsborough. You shouldn't have that problem because you have plenty of credits to take in the nursing program. But just in case, you definitely want to make sure that you follow up with me, your advisor, so that you know that you have all of the requirements in place. The other thing I would like to stress is all of these courses, even the courses that you take beforehand, in order for the nursing program to accept the grade, it has to be a C or higher. If you get a C minus in any one of these classes, you've effectively failed that course and you've effectively failed out of the nursing program. So keep that in mind. You do not want to get any grades below a C within the courses you need for the nursing program. That doesn't count courses that you don't need for the nursing program, such as like humanities, arts, histories, things of that nature. But every course you see on this list, you must score a C or higher. Actually, you want to score higher so that you have the option of making sure that you're more competitive to get into the program to start with. But you want to stay in the program by at least maintaining a C or higher. After that's all said and done, and you've sat for your exam and you passed your exam, the clinical sites that you worked at during the program may even be inclined to offer you a job. So you could come out of the program with a job and the opportunity to go to a bachelor's of nursing program, which Kingsborough has affiliations with several different schools, and I'll talk about that in my next video, so that you can have a little bit of idea. But this is effectively the 2-year degree, the 2-year phase part about it. So we don't typically count the year it may take you to do the preclinical phase. The 2-year degree actually starts in the nursing program once you hit semester 1 of the clinical phase. So I hope this video has been informative to you, and I look forward to seeing you all. If you have any questions or concerns, you may email me at benjamin.stewart@kbcc.cuny.edu. That's benjamin.stewart@kbcc.cuny.edu. I hope you guys are safe, and I hope you guys are healthy.